This is a nation overwhelmed. For the third straight day in India, there has been a record rise in COVID cases, but patients are being turned away at hospital doors. This one in New Delhi has run out of oxygen as new COVID patients run out of breath.
ये सिर्फ ऑक्सीजन की वजह से मेरा पति मारा इन्होंने.
My husband died just for the lack of oxygen. They've killed him. They told me his heart has failed. How can over 20 people die like that at the same time? They didn't even tell us what had happened.
I came here to get my grandfather treated for COVID. They're not letting us in. We don't get it. We were told there is no doctor. If there is no doctor, then where will we go? His oxygen level is dropping alarmingly.
They have no shame at all. Do you know how a human being dies without oxygen? Have you seen a fish out of water? More than 20 patients have died here suffering just like that, just like a fish out of water. This is unimaginable.
The despair and anger here is against the hospitals and medics for turning away those in need. But amidst the national shortage of oxygen, doctors are trying to help hundreds of thousands of patients with their hands tied.
We've just received 500 litres of oxygen. This will last for maybe 30-45 minutes. The requirement for a day is 8,000 litres. We don't understand what to do with this 500 litres when we require up to 8,000 litres.
The dash to replenish India's oxygen supply is a military operation. In the past day, there have been 2,624 new deaths and have raised alarm in the international community. Just weeks ago, the government of India had declared COVID's endgame, and huge events continued.
In recent months, we've seen millions of people gathering for religious festivals, for protests, for many other sporting events as well. And that is something which will no doubt be investigated. But I would say at this moment in time, let us concentrate our efforts to ensure that India can overcome this virus, and the UK should be standing shoulder to shoulder.
And so far, the UK has pledged to help, but the rapid resurgence of devastating scenes like this has sent a reminder to the world of COVID's persistent threats as questions grow over how India's outbreak has risen so quickly.
Well, earlier I spoke to Dr. Harjit Bhatti, who works in a hospital in New Delhi, and I asked him what the situation is.
The situation is very horrific. It's actually very traumatic also, mentally traumatic, because we are seeing lots and lots of patients who comes to us begging for hospital beds, for oxygen, or they were just crying of saying that our patient saturation is falling and please handle them or please give them beds in your hospital. But our hospitals are already overwhelmed, so there is no more beds available, there is no more oxygen points available, and even at a single oxygen point we have to give oxygen to 2, 3, 4, or sometime even I have even seen the oxygen given to 10 patients from a single oxygen point. So it is becoming very difficult, very traumatic, and very exhaustive.
What is happening to those people who don't have money or private health insurance? Is there COVID care for the poor?
No health care available for the poor. Even the public hospitals, the public funded hospitals, they provide very limited facilities, and they have a very limited number of beds. So people were ultimately forced to go towards the private hospitals.
What has gone wrong? Just a few weeks ago, people were talking about the number of cases in India being so low that the cities had reached herd immunity.
This concept of herd immunity was wrong. I have seen the patients who were infected last year, then they were vaccinated, received 2 full doses of vaccine, and now still they are infected. And second thing, the promotion of vaccine is specifically, our government promoted vaccine as a treatment, rather than being a preventive measure or a preventive modality. And so they have just promoted it as a vaccine, that now vaccine came, now we have win over corona. At least this is very well known from the beginning of the pandemic, that oxygen is a very life-saving thing during COVID management. And even if at least oxygen was sufficiently maintained in the hospitals or adequately provided to the hospitals, that too can have saved many lives. But there is no procurement was done for the oxygen. and neither any attempts was made to increase hospital beds, nor any attempts was made to make big isolation centers so that we can isolate more and more people, either test more and more people, to try to break the chain of transmission. Neither any containment zones was made properly, and everything was just laxed. And we have seen even our ministers, our government ministers, responsible government ministers like Home Minister, Prime Minister, they are doing large gatherings, large rallies of hundreds of thousands of people are gathering in their rallies.
With the number of cases going up, this is going to get worse. What do you think is going to happen?
The situation today is so bad. I can't imagine what will happen in the coming days. Every day when I wake up, it's becoming so horrible that I have so many missed calls, so many people are calling for beds, so many people are asking for home management. There is no personal life or like no time for ourselves was left. All time is only for the patient care. Even if now some active interventions was not done, then it will result into the worst crisis of the century.